Video, I'm going to demonstrate how to perform the laboratory competency assessment. I want to ensure that I am wearing the appropriate PPE of gloves, lab coat, safety glasses, and a face shield. The first step of the procedure is to properly label two tubes. A properly labeled tube includes the contents of the tube, in this case Evans blue dye, and the dilution or concentration if known. Tubes should always be labeled before use. After labeling, I review my procedure and see that I need to select a volumetric pipette capable of delivering 3 milliliters of distilled water. Next, I open the bottle of distilled water. I use my non-dominant hand to control the bulb while my dominant hand holds the pipette. Before using the volumetric pipette, I determine where the etched line is located. Then I squeeze the bulb and attach it to the pipette. Then insert the pipette into the liquid vertically and slowly release the bulb to aspirate diluent into the pipette so the liquid level is above the etched line. I quickly remove the bulb and use the pad of my index finger to stopper the top of the pipette. I can slowly drain liquids to the etched line by releasing pressure with my index finger. The bottom of the meniscus should be at the etched line on the pipette. Remove the pipette from the distilled water. Inspect the pipette for visible droplets on the outside of the tip. If there are droplets, use a Kim wipe to gently remove them. Place the pipette at an angle in the 1:7 dilution tube with the tip touching the tube wall. Allow the liquid to drain by gravity. Volumetric pipettes do not need to be blown out. After you're done, place the used pipette in the metal tray. Replace the cap on the distilled water bottle to prevent spills. The procedure states that I need to deliver 500 microliters of Evans blue dye stock to the 1:7 dilution tube, so I need to use a P1000 micropipette. I set the P1000 micropipette volume to 500 microliters, ensuring that I am coming from a higher volume. I securely place a tip on the micropipette. Then I open the Evans blue dye stock bottle and enter the bottle vertically, ensuring that the pipette tip is only a few millimeters into the liquid. Then I pre-wet the tip 2 to 3 times and then aspirate the stock to the first stop of the micropipette. I place the tip at an angle and touching the side wall, and then dispense the solution by pressing to the second stop on the micropipette. Then I discard the used tip into the sharps container and close the Evans blue dye bottle. Mix the 1:7 dilution tube with the vortex mixer. Step in the procedure is to deliver 3.5 milliliters of diluent to the 1:50 Evans blue dye tube using a serological pipette. I need to select the smallest pipette that is still large enough to hold the full volume. Then I determine where 3.5 milliliters is located on the serological pipette. Then I open the bottle of distilled water, and then I can use the bulb and serological pipette to aspirate 3.5 milliliters of diluent. With the bulb attached to the pipette, I enter the liquid vertically and slowly release the bulb to aspirate diluent into the pipette. Quickly remove the bulb and use my index finger to stopper the pipette. Then gently release pressure with my finger until the bottom of the meniscus is at the correct volume. no visible droplets on the outside of the pipette. If there are, use a chem wipe to gently remove them. Place the pipette at an angle in the 1 in 50 dilution tube with the tip touching the tube wall. I allow the liquid to drain by gravity, and then I use the bulb to blow out the last drop in the pipette. Then I place the used pipette in the metal tray and close my diluent. Next step in the procedure is to deliver 70 microliters of Evans Blue dye stock to the 1 in 50 dilution tube, so I need to use a P100 micropipette. I set the P100 micropipette volume to 70 microliters, ensuring that I am coming from a higher volume. After setting the micropipette to the correct volume, I securely place a tip on the micropipette. I open the Evans Blue dye stock bottle, and then I enter the bottle vertically, ensuring that the pipette tip is only a few millimeters into the liquid. Then I pre-wet the tip 2 to 3 times, and then aspirate the stock to the first stop on the micropipette. Pipette at an angle and touch the tip of the micropipette to the tube sidewall, and then dispense the solution by pressing to the second stop on the micropipette. I discard the used tip into the sharps container and close the Evans Blue dye bottle. Then I vortex the 1 in 50 dilution tube with the vortex mixer. Now that the dilutions have been made, I can set the spectrophotometer to the correct wavelength of 600 nanometers. I also make sure the spectrophotometer is in absorbance mode. I add at least 3 milliliters of distilled water to a cuvette using a squeeze bottle. I compare the volume in the cuvette to one of my prepared dilution tubes to ensure the cuvette holds at least 3 milliliters. Then I wipe the outside of the cuvette with a chem wipe. Then I place the cuvette in the chamber and close the door. I press the Zero Absorbance 100% Transmittant button to blank the spectrophotometer. After blanking, I can remove the cuvette from the chamber and set the blank tube in the rack in case I need to use it again. Next, I pour the 1 in 7 dilution into a cuvette. There is a trick to getting the last drop out of the tube. When I am pouring, I make the tubes kissed as the last drop comes out. I wipe the outside of the cuvette with a chem wipe and place the cuvette in the chamber and close the door. I record the absorbance of the dilution on my sheet, including leading zeros in all decimal places. Then I transfer the 1 in 7 dilution back to its original tube in case I need to measure it again later. I rinse the cuvette with distilled water and decant the waste into the decant bucket. Then I gently tap the cuvette against a chem wipe to remove extra liquid. I discard the used chem wipe into the biohazard trash. Next, I pour the 1 in 50 dilution into the clean cuvette. I wipe the outside of the cuvette with the chem wipe and then place the cuvette in the chamber and close the door. Pour the absorbance of the dilution on my sheet, including the leading zero and all decimal places. I transfer the 1 in 50 dilution back to its original tube in case I need to measure it again later. I rinse the cuvette with distilled water and decant the waste into the decant bucket. Then I gently tap the cuvette against a chem wipe to remove extra liquid. I place the clean cuvette upside down on the drying rack. Then I decant the distilled water from the blank cuvette and dry it on the chem wipe, and then place it upside down on the drying rack. Then I discard the used chem wipe into the biohazard trash. The last step is to decant the Evans blue dye solutions into the decant bucket and discard the tubes into the biohazard trash.